7.
Just for the visits, $450.
Yeah, just for the visits. No cleanings, no anything else.
So remember what these dentists were told when the appointments were made. They were told that Mara had not seen a dentist in 2 years, just wanted an assessment, would pay out of pocket. Those are the baselines. So what happens next in our investigation? Well, surprise us all. Take a look.
The first dentist I visited undercover really surprised me.
The only cavities I see are on the top of the teeth and the middle of the teeth. You have to do the cavities.
I have cavities in my wisdom teeth?
I can show you what they look like.
Okay. I'm going to trust your judgment, but you're fairly certain that that's the case?
Very certain.
Okay.
100% certainty, yeah.
And the cost to fill those 2 cavities along with a mouth guard he recommended?
Your total for the full cost and fillings comes out to $1,150.
$1,150 for just getting out of that visit, and I am shocked. 2 cavities? Let's see what the next dentist will find.
There's 3 things that are going on. One thing, tooth that had a root canal, that we need a crown protected so it doesn't break.
On this side?
Yeah, then on the other side there was a filling from a decay going in underneath that filling. And then there's one more filling, which is a regular filling on the top here that needs to be replaced.
The total cost? $3,500.
So apparently I need 2 replacement fillings and 1 new crown, but hey, at least no cavities. Let's see what the next one says.
I was in the chair for less than 10 minutes when she started finding problems.
She has an MO on 30 and an occlusal on 32. You also do have some cavities on your wisdom teeth, the teeth all the way in the back.
On the top or the bottom?
On all 4 of them.
I have 4 cavities.
Actually 5.
Actually, it wasn't 5. It ended up being 6 cavities. The total cost to repair them, $1,930. I'm just shocked. I mean, 6 cavities when I was told I had none. I just don't know who to trust.
Hey, I'm looking at the audience. They're shaking their heads. More importantly to me, the dentist colleagues, the panel, are shaking their heads. So let's go to you guys. From 0 cavities, Dr. Ashford, that was your professional opinion. What's your reaction to the dentist finding things that you didn't see, or were they not there?
I'm not here to say that my exam was the right one and everyone else's was incorrect, but it's not only necessarily if a filling needs to be treated, but also when a filling needs to be treated. There are certain fillings that Mara had that were not the most beautiful looking restorations I've ever seen, so simply just replacing fillings just because something doesn't look aesthetically perfect doesn't necessarily mean that's the correct treatment, and I tend to be a little bit more conservative, and in that instance, I recommended just that one. I think everything else will hold up for quite a long time.
So, Dr. J, this is a judgment issue. I go to you. I trust you because you are conservative.
Thank you.
And I value that. You know, you're thoughtful, you point stuff out, but you do the least you can. So how do you go, if you're a consumer, from being told you need maybe 1 filling or no actual real bad cavities to maybe having 6 things having to be addressed?
Well, you really got to get to know your patient first. You can't just, on day 1, say you need A, B, C, D, and E. Our job is to promote longevity of tooth, not to just drill and fill them.
Dr. Cooper, you represent the American Dental Association, which of course is robustly full of wonderful, ethical people.
Absolutely.
But the profession must get concerned when you see this kind of variability as well. Getting from 0 to 6, or a big number difference between one exam that we trust and another exam that we just heard.
Yeah. Let me say, first of all, that you're right. Most dentists are really hardworking, impeccably honest, and have devoted years and years of training to making sure that they're doing what's absolutely best in your best interest. In making that determination, you're both right. There is a range within which most dentists work to determine what the best treatment is based on you and your needs and your history, okay? So, for example, at one end of the range are dentists who tend to be more conservative in their treatment. There are other dentists who are a little bit more proactive, okay? So make sure that if one dentist has told you something and another has told you something else, that you don't just assume that both of them are being dishonest with you. It may just be that they're practicing along that spectrum of different philosophies. But, you know, the heartbreaking thing to me, the most heartbreaking thing to me about watching that video is the look of utter confusion on your face. No dentist wants a patient to be that confused. Most dentists really want you to understand what's going on, really want you to understand what we're saying to you. And so if you're feeling confused because you've gotten different opinions, because you're not understanding what the dentist is saying, ask the questions, because it puts the power back in your lap to make good decisions for you. Ask to see x-rays, ask to see pictures, ask if there are any alternative treatments. You can ask for priorities. When patients come into my office, I always